Hello, my name is Dr. Julian De Silva. Today I'm going to be answering a number of questions on facelift and neck lift surgery. And I performed this surgery for many patients over more than 10 years. I'm a board certified oculofacial and plastic surgeon, and I only operate on the face, and this is my area of expertise. So one of the commonest questions that patients ask me is, how long will my face and neck lift surgery last? And of course, there are a number of things that we need to consider when answering this question. And the ballpark figure would be, well, a face and neck lift procedure would be expected to last 8 to 10 years. However, there are a number of considerations when thinking about this number. Firstly, even though it may last 8 to 10 years, it does depend on the type of technique that is done. And for example, like previously skin-only type facelifts, well, if it doesn't address the underlying anatomy, i.e. the SMAS layer that drops down with gravity and gives changes in the jawline, the neck. A skin-only facelift, well, you will see a difference, but it's going to last a shorter duration of time. A SMAS lift, which is the technique that's existed for at least 10 years now, well, that will give a longevity of 8, perhaps 10 years. And over the last 3-4 years, we've seen this evolution in technique, the deep plane facelift. And we believe that by releasing ligaments and lifting the central part of the face, well, the longevity may be higher, but currently the scientific papers supporting this still suggest it lasts 8 to 10 years. The other factors that are important are, well, are there other things that you may require in terms of facial aging at the same time? So, for example, a lot of us lose a certain amount of volume in our faces and fat, and that fat results in sinking and hollowness. And if we can complete an associated technique such as fat transfer, or there are other ways of adding volume such as non-surgical fillers, implants, well, these techniques will give a longer lasting result because the volume is enhanced. And then there are other techniques as well that can be quite favorable. It might be eyelid type procedures, lifting of the tail of the brow that comes down with gravity. It may be resurfacing and polishing the skin that's been sun damaged with time. And all of these things will complement the result from a face and neck lift surgery and will tend to make it last longer. Definitely there are genetic factors. Many of the younger people come to see me have some degree of hypermobility, but you may have had early menopause, or there may be another factor that's resulting in just faster aging or more skin laxity. Things like hypermobility, you can't change that because that's genetics, that's how you're made. However, there's more and more evidence that certain supplements, perhaps collagen, may have a benefit. But overall, in those individuals, the procedure is likely to last shorter length of time because your natural propensity for skin laxity is higher. The third element is your kind of lifestyle, how well you look after yourself, and that may be in terms of exercise, nutrition. All of these things we know make an important impact on how the skin and your face age with time. So in summary, I would say that, how long does a face and neck lift surgery last? Well, we can say broadly it's about 8 to 10 years. However, the additional factors are the type of technique that are used, the associated procedures that might benefit at the same time, and then also your lifestyle and genetic factors are also going to be important in this area. The second question that I really like to answer today is one that many patients ask me is like, am people going to be able to tell that I've had a facelift and a neck lift procedure? And I think it's important because many people are worried about the potential for scars, the healing period. Many men have shorter hair or even no hair because of alopecia, and the scars are so key of importance in those individuals. The key thing is, well, firstly, is the technique that's used. And the previous techniques in the past, facelift techniques such as SMAS lifting, they tended to put some tension on the healing scars, and the scars tended to be a bit wider, and very occasionally they would even stretch the ear or change the ear shape. Modern technique that's really evolved over the last 3 years, deep plane facelift surgery. Well, the benefit of that technique is because the deeper plane of anatomy is lifted, there tends to be less tension on the scars. So the scars tend to heal better, they tend to be finer, there tend to be effects on the ear shape, and that's a combination of our understanding of the face and newer techniques. The second thing is attention to detail. So making a straight line in front of the ear in terms of a surgery and a scar is definitely not ideal, because that scar is going to be more obvious and less natural. A scar that's hidden around the natural curves of the ear, hidden under the chin, hidden behind your ear, well, these scars are already much more discreet. And to some extent, it's the devil is in the detail. There may be superficial stitches that are removed after like 1 week, but the deeper stitches that stay there will add support while the period is healing. I have one patient of mine, a gentleman who unfortunately has lost his hair with alopecia. He was very concerned about the scars. He always wears glasses, and so we actually changed the shape of the scar to match his glasses. So regardless of the healing, which tends to be good if we're meticulous, hiding in the glasses made it very difficult to see the scars even a couple of weeks after the surgery. The other element in terms of like being natural is what every individual person needs is kind of unique to you. And I ask many of my patients to bring an old photograph so we can see how your face is individually aged, because there are many individual characteristics that are unique to you. And so no one needs the identical surgery. There's a degree of artistry to facial surgery so that the surgery is tailored to each individual. So in summary, are most people likely to notice that I've had surgery? Well, the answer is no, because if things are done naturally, the scars can be hidden in your natural creases. As long as you have a little time for the majority of the swelling to go down, the scars can be hidden. The best compliment is you look refreshed. What have you been up to? But in my experience, most patients, friends, family will not notice. The best compliment is you look refreshed, or the best version of yourself. The third question that I really like to address today is in terms of anesthetic. And many of the patients who come to see me are concerned about having general anesthetic and the risks associated with general anesthetic. And some patients have had difficult recoveries where they've been out of it for many hours, or had nausea or sickness. And in modern day facial surgery, well, rather than using general anesthetic, for my patients we offer like a sedation, a twilight anesthetic. And we pioneered this in the UK for many years, and we have a patent for the formulation that we use. But using sedation anesthesia, well, you're still breathing through the surgery yourself. Your recovery tends to be much faster. Like, you tend to recover over about half an hour after the surgery, and you can walk out of the operating theatre, and the whole experience just tends to be milder, because it's a bit like waking up in the morning after a good night's sleep. You tend to wake up quite quickly. And similarly with sedation, and many of my patients I can talk to after the surgery and have conversations with them, which was much harder when I used to do the same procedures under general anesthetic. So in answer to this question, well, in modern day techniques, you don't need to have general anesthetic to have face and neck lift type procedures. You can have this under sedation or twilight anesthetic. And I have many testimonials and video testimonials of patients who've talked about their experience with this. And if you'd like to talk to a patient who's had this kind of experience, then please reach out to us. The final question that I'd like to ask today, which many patients ask me, is, well, what is going to be the recovery from face and neck lift surgery? And broadly speaking, most of the recovery tends to be swelling. Sometimes there can be some bruising, sometimes there can be other factors that are involved in healing, but the majority of healing is swelling. And the majority of swelling will go in the first few weeks. And I generally say to my patients is, have at least 2 weeks where you're not going to see too many people socially, professionally. If you've got a very important event like a wedding, a birthday, an important professional event, I'd say have even more time to allow for that. But swelling and bruising tend to be the main things. Now, there are measures that we can take to mitigate that. Some patients heal really quickly and will not need these measures, but if you tend to have a bit more swelling, and that might be genetic factors, it might be medical factors, or it may just be chance, there are things we can do during the surgery. And the very last part of the surgery that I do for my patients is I do face and neck lift surgeries, use a tissue glue, and this is a very special glue in that it's the very first stage of healing, and that tends to limit the amount of swelling that patients have, and also minimize bruising because it's the first stage of clotting in terms of physiology. In addition to that, we put like a special cooling mask on immediately after the surgery to help reduce the swelling from time 0. Now, there are things that can be done after the surgery, just to mention a few: MLD, lymphatic drainage, hyperbaric oxygen, use of anti-inflammatory medicines. All of these in combination can help reduce swelling faster. Some patients will not need them, but they're always available if need be. Generally speaking, you need 2-3 weeks, but if you had something really important, I would allow a bit more extra time just in case. So I hope this has been helpful for you. If you have any specific questions that you'd like to ask me about face and neck lift surgery or other facial procedures, please do reach out to us and I'll be happy to answer them. And good luck.